Hello Tom, how are you feeling? I'm hearing you coughing quite a bit. Okay. How are you feeling at the moment you're coughing? Simply coughing. Are you producing any sputum?
Oh, I am, yeah.
Okay. How long has this been going on for?
Oh, a couple of days.
Oh, okay. Because you came in with the fall, but you've also been coughing, isn't it? Okay, what I'll do, I'll check your blood pressure, because it seems to be a bit warm when I'm touching you. You feel a bit warm, so I'll check your blood pressure and your temperature, and then I'll get the doctor to see you. Oh, your temperature is quite high, it's 38. Your blood pressure is a bit low. Please help. Hi.
Hi there.
This is Tom Norton. He's just coming from A&E. He's a 89-year-old gentleman who's coming with a fall, but I've noticed his coughing. It's reporting that his coughing is producing sputum. I've checked his observations. His temperature is 38.3. His heart rate is about 108. SATs are low to 91. His respiration rates are 28. He's got a low blood pressure.
Okay.
That's it in place.
Yeah, that's fine. Do you want to start getting some oxygen ready? Just 15 litres of oxygen via a non-rebreathe mask. I'll let you know when to put it on.
Okay.
Hi, Tom. Hi, I'm Aubrey. I'm one of the doctors. How are you feeling?
Hi. Oh, not right good.
You've been coughing quite a lot.
Oh,
is that right?
Loads of green phlegm.
Okay, can I just have a look in your mouth?
Yeah.
Okay, airway looks patent. He's talking to me. Do you want to put the oxygen on?
Okay. Tom, we're just going to put some oxygen to help you with breathing.
Okay. So the SATs are 90%, respiratory rate is 28, so he's breathing quite fast with that cough. You said he was producing sputum. What colour was that?
It's green.
Okay, alright. Alright, let's have a look. So, trachea central, no accessory muscle use, air entries equal. Okay, so he's got quite a lot of crackles on the right side of his chest. So could we just order a chest x-ray as urgently as possible, get it to portable to here, and we'll do an arterial blood gas when we've got time as well. I'll continue my assessment. So this oxygen sats have come up a bit to 95% and the respiratory rate's down to 22. So I'll move on to circulation because I feel like we've done what we can for breathing at the moment. Tom, I'm just going to have a feel of your hand.
Checking the bloods.
Feels quite clammy. His pulse is tachycardic, it's regular, 107. Bit not great volume. And his cap refills about 3 seconds. JVP is visible, but it's a bit lower. Let me just have a listen. His heart sounds normal, so his blood pressure is 88/49. So I think what we should do is we should get a catheter in to measure his urine out because his blood pressure is very low. Is there a cannula around that? He's got one in already, but I think we should put a second live bore cannula in.
Okay. And would you like me to set up some fluids as well?
Yes, please. So we'll have a 500ml fluid bolus, 0.9% sodium chloride, run over 15 minutes, please. I'll put this wide bore into this left ACF. We can run that through this pre-existing cannula. I'll take some bloods out of this, so FBC, Usinese, LFT, CRP, coagulation screen, and I'll also do some blood cultures at this point, which I'll do separately from the cannula. Will you start setting that up?
Mr. Smith, I'll just put up the IV fluids just to help. Your blood pressure is a bit low. And we'll check it again. This should help you feel a little bit better.
Okay. We'll also get an ECG at some point if that's okay. Move on to D. So do we have a temperature for him?
Yes, temperature 38.3.
Okay, so this look with productive cough, this looks most likely like it's going to be a pneumonia, especially with that temperature. So what I'll do is I'll just check the guidelines. I'll write up some IV antibiotics and also a gram of IV paracetamol to give for the temperature. Just have a look. So guidelines, so we'll treat as a severe pneumonia, I think, given that he's hemodynamically unstable. So that's 2 grams 6-hourly IV ceftaxin and 500 milligrams IV BD clarithromycin. So I'll write up the ceftaxin, clarithromycin and a gram of paracetamol. So if you want to put the antibiotics through the left cannula, and once the fluid bolus is finished, we can give the IV paracetamol as well. I'll write them up.
here, I'll just check with you.
Yep, sure.
Yeah. We'll put them up.
Yeah.
Okay, Tom, we're just going to give you some antibiotics to help. You seem to have an infection. Does this will help treat your chest infection?
While you do that, I'll continue the assessment. Tom, how are you feeling? Okay. Feel a bit better? Alright. Okay, so he's still talking to me, still alert. He's opened his eyes spontaneously. His GCS is 15. Could we just, once we've got the antibiotics up, could we just get a blood glucose reading, if that's alright? Okay. Tom, I'm just gonna, can I just have a look at your tummy? Is that alright?
Yeah.
His blood glucose is 5.6.
Okay. Any pain in your tummy at all?
No.
Okay. And his blood pressure's come up a bit with that fluid bolus to 102/51. Alright. So we've got the antibiotic running through and we've got the fluid. So yeah, once the fluid's done, we'll give IV paracetamol as well for the temperature. Just fully expose your legs as well, Tom. Just looking for any rashes, any bleeding or anything. Okay. The calves are soft and non-tender and not swollen. So I think at this point I'd like to get some help from my registrar. I'm going to give them a call if that's alright. I'll just let them know, Tom's quite poorly with a chest infection, he's having antibiotics, alright? Okay.
Thank you.